Hello, everyone, and welcome. My name is Deborah. I currently attend the graduate program at Grand Canyon University, and the current class that I am recording this for is called Leading as a General Manager. Our assignment was to work on strategic plans that would improve the overall efficiency, performance, and growth of each of our organizations. And so, what I'd like to discuss with all of you today is the strategic plan that I have personally been working on to improve patient documentation. So, for the last 3 years, we have sent out surveys to all of you, and I want to thank you very much for sending them back. It has helped us to answer all of those questions and concerns regarding the lack of communication in patient documentation, the disconnect with medication errors, and the questions that some of the community providers have had in the past on information sharing. The electronic medical record system that we have chosen is called Point Click Care, and we are very proud to be implementing this system. This is a system that is going to take a lot of the burden off of each and every one of you when it regards patient documentation. So at first I want to talk a little bit about how we came to this decision. So 3 years ago, the stakeholders, the owners, and myself were wondering how we can improve the branding recognition within the community, to improve the quality assurance within our programs, and most importantly, how we can keep our employees happy and make them feel that they are contributing to society, the patients, the families, and also have fun while they're doing it. So we have come to the decision that having an electronic medical record system is going to not only improve all of that, but is also going to reduce some of the fiscal burden that we have seen in regards to accounts receivable. Some of the accounts receivable and outgoing bills that we have not been able to send is due to a disconnect in improper documentation. What I mean by that is things get lost in communication. When you have paper form, I know personally being a nurse, if you don't document it, you didn't do it. And so there's a lot of different steps. I also want to talk to you a little bit about the patients that we see. So we work with some of the most medically fragile children, ranging from birth to 21. And as we all know, there are a lot of moving parts when a patient is coming into our program. From the moment that we receive the call from either a hospital, a children and youth center, from a family even, we have to start the process of discharging. And so there are documents that are going to be written. There are pages and pages of records that we have to have in place for each and every one of our patients. And it's not just one person. It is a multidisciplinary team effort to make sure that each of the patients that enter into our organization are entering in a safe environment, a smooth transition, and that we are able to communicate effectively to be the best that we can possibly be. So the owners of the company wanted to be sure that we had the best EMR system that we could possibly have. We have chosen Point Click Care. Point Click Care will give you everything that you can possibly imagine in just the touch of a button. Medication management is the most important thing when it comes to a patient that enters into our program. We want to be sure that we have all the medications in place, whether it is a increase, a decrease, or a discontinued med. We want to make sure that we have all that information in place. We also want to make sure that we have all of the DME equipment that is available, any of the respiratory settings that we need for those children that are on ventilators. And so with that said, you'll be happy to know that, again, just as with a point and a click of a button, you're going to be able to click a yes and a no and to be able to sign off on that med. Not only that, the supervisors are able to click on the medication pass for that particular shift to be sure that everyone is on time. And it's not to be a micromanager, but really what it is to see how everyone's doing. We all know as clinicians that having that one-to-one patient care is so important. And so if you have a patient that is having a change in diagnosis or a change in status at that moment, you want to spend a lot of time with them. That might mean that those other medications are going to have to hold off, and we can't do that. We have a time frame that we have to have that done. And so a supervisor is able to click on that medication pass and be able to see exactly where the nurse is. Is everyone on time? Are the medications given within that time frame? And if not, then they can jump in and help so that they can provide the best quality care for the patients. In addition to this, there are reports that you can pull, again, as easily as just pointing and clicking. So a supervisor can pull up a report. A clinical liaison can pull up a report outside as long as there's internet access. If they're in a hospital setting and they're following up on a patient that has been admitted in for a treatment, if there was an emergency, if they're in there for a procedure, they can pull up a report so that they can exchange that information with the medical team at the hospital. We also have subspecialty appointments for our transition team, and so our clinical liaisons are able to pull up those reports as well if they need to review an urgent lab to show that to the doctor at the time. So there are many different facets that we have as far as the cost efficiency of this particular program. The point-click care system that I am currently speaking about, from the timeline of training, having our IT support system that is going to be there to finish, it will be approximately around $250,000. It could be more or less. It really does depend on the program itself. We have the sites that span across the entire state, and so it will be a centralized system that everyone can click on a patient that is, that obviously has the access to do so, and they can pull up that report. There are times where we do have patients that transition from one site to another if they are moving, if their family wants them to be closer, and so we are able to have a centralized program to do that. The overall efficiency of this program is going to be something that you are all going to be very pleased with. I am also going to show you a slide presentation, and so I want to thank you in advance for your patience and also let you know that we will be launching Point Click Care January 5th of 2015. Thank you for your time.